There's a medication problem in this country, and we're not talking about the opioid epidemic. While over-the-counter drugs are safe and effective when they're used correctly, experts say many Americans are overusing or misusing them with potentially dangerous consequences.
Anita Brickman educates consumers about the safe use of over-the-counter medications that treat ailments including allergies, fever, cold, flu, and pain.
They're a first line of defense for minor to moderate symptoms, and they're used safely and effectively by millions of Americans.
Headache pain specialist Dr. David Dodick says over-the-counter medications are an important tool, but his research shows a problem.
My colleagues and I recently completed a population-based study across the United States and found that amongst patients who had at least one headache within the past 30 days, 15% overused these over-the-counter analgesics.
It's not just headache patients. Dr. Dodick says the perception for some is that anything you can buy without a prescription isn't really a drug, and that for people with certain risk factors, overuse and misuse of certain OTC pain relievers can potentially lead to gastrointestinal problems, including ulcers, kidney disease, and that's not all.
We know now all of them increase the risk significantly of myocardial infarction or having a heart attack and stroke.
Dr. Dodick says when it comes to OTC pain relievers, he isn't worried about addiction, but he has seen frequent headache sufferers slip into a habit of taking the medication, say, before an event, in anticipation of getting a headache.
There's a habituation where habit forming, they take the medication and think nothing of taking the medication at the slightest sign of pain.
3/4 of primary care physicians recommend over-the-counter medications before a prescription. Brickman stresses the way to avoid possible misuse is to follow the drug facts label very closely every time.
It has all the information you need: how often you should take this medicine, how much you should take, and very importantly, when you should stop and consult a healthcare provider.
The FDA does not regulate over-the-counter medications like prescriptions, although OTCs do have to prove that they're safe and effective, and the FDA does regulate the labeling.
The Michigan State House has passed a new set of bills that would hold drones